it's not just the programs that matter, but it's also just that total affordable housing supply that becomes part of, the need. And so that's been our motivation.
Welcome to Buzz House, a Baker Tilly podcast where you can find all the buzz around multifamily housing. I'm Don Bernards, the partner in charge of Baker Tilly's multifamily housing practice.
And I'm Garrick Gibson, a partner at Baker Tilly, also specializing in consulting on multifamily housing transactions across the country.
Each week, we'll bring you a guest or a topic in the multifamily housing industry that will help you win now and anticipate tomorrow. Let's get started. We are excited to welcome into the Buzz House today a number of guests, all talking on the same topic, of course. We're going to start with Tracy Kaufman, a senior advisor to the National Council of State Housing Agencies, or many of you know NCSHA. We're going to have Nora Bloch, whose position is Initiative Director with the Center for Community Investment, and also Kevin Progar, Project Director at UPMC Health Plan. We're all gathering here today to discuss a little bit more about the intersection of housing and healthcare or hospital systems. Hot topic, obviously the topic at many conferences you're going to and just in the media as well, and it really keeps growing momentum. So really excited for this discussion. Really looking forward to it, and we're going to jump into our discussion with Tracy, Nora, and Kevin. I'm going to turn it over to Garrick. Garrick?
Thanks, Don. And Tracy, Nora, and Kevin, thanks for being on our show. Before we dive in, we like to allow our listeners to get a sort of a background of our guests. So please let our listeners know a little bit about your respective organizations and your roles within the organization.
Hi, Tracy Kaufman. Thank you, Garrick and Don, for having all of us and addressing this great topic. Most of your listeners know that the National Council of State Housing Agencies is a nonprofit dedicated to affordable housing through the work of the nation's state housing finance agencies. HFAs play a central role in this country's affordable housing system, delivering the financing that makes the purchase, development, and rehab of affordable homes for low and middle income households possible. I'm working with NCSHA to lead their Healthy Housing, Healthy Communities Partnership project, which we'll dive into more shortly.
Hi, everybody. Thank you also. So I'm Nora Bloch, and I work at the Center for Community Investment, where we are really focusing on using what we call the capital absorption framework as a way to help guide the resources that are out there towards the communities that need them. Like everybody wants to live in communities where they have the things they need to thrive, whether it's affordable housing, good jobs, economic opportunities, and structural racism is really the big bad guy, has shaped our financial and political systems to deliver more resources to the communities that have them already and further disinvest those that don't, most often Black communities and other communities of color. And so that level of disinvested communities we've found have been practicing different ways. We're using a capital absorption framework so that communities can collaboratively organize for more equitable and effective investment systems, helps them get the resources they need to have what they want in their own communities. And CCI created the framework. We help people use it. And we've found working with the health sector a great way to tap into a resource that is still considered, quote unquote, unusual or less common. And again, work in sort of that collaborative way to help health systems understand what's possible, to do sort of translation between, if you ask housers and health systems what if they know what a CDC is, they'll both say yes, but not mean the same thing. Mm-hmm. So that's just like one sort of easy example. But we've worked with health systems who were already doing upstream investment, as we call it, in affordable housing. We've worked with health systems who are just getting their feet wet. And now we've been excited to help provide content and training for Tracy's effort with NCHSA. And also we're actually running a second cohort now with NeighborWorks organizations, similarly helping affordable housing developers learn how to build partnerships, investment partnerships with the health sector.
Thanks, everybody. Appreciate the opportunity to be here. My name is Kevin Progar. I'm a project director with the UPMC Center for Social Impact. And given I think the health sector is probably a little less common to the listeners, I'm going to do kind of the big waterfall of what UPMC is and where the Center for Social Impact sits and all that and what we're about. So at the top level, UPMC is a $24 billion health provider, health insurer, technical assistance provider around the world, really kind of pushing the edge of innovation and excellence in all things related to healthcare. Has more than 90,000 employees and is the largest non-governmental employer in Pennsylvania. So we're, very much an anchor institution, not just in Pittsburgh, but in the entirety of the state. So that's a big piece of what we do, is really thinking about community health as well, because so many people rely on us for healthcare. A major vision of UPMC is the Insurance Services Vision, aka the UPMC Health Plan, which is the largest insurer in Western Pennsylvania. So we have over 4 million members across commercial, Medicare, Medicaid, and a whole host of different insurance products. And that is where the Center for Social Impact sits. So the Center for Social Impact launched in about 2019, recognizing that ultimately a lot of health outcomes are driven by community factors, environmental realities, and then just the context in which our members live, work, and play. So in recognition of that, we're trying to take on both social determinants of health, which are those big structural challenges, and remember what we call health-related social needs, which are those that impact one specific person in a set of specific ways. And so my work with the Center for Social Impact has really been around crafting our Homeward strategy, which is a housing initiative really aimed at improving access to affordability and other housing services as needed for both our members, our employees, and all the communities we serve.
Very good. It's just amazing, your backgrounds, your forethought. I mean, just thank you again for joining us. Just a lot of really good things here and great ideas I think will come out of this. So I'm just going to start with Tracy. Tracy, our conversation started in May when NCSHA announced it awarded grants to 6 state housing finance agencies, or HFAs, to develop strategic partnerships with hospitals and other health organizations to finance affordable housing. Tracy, could you bring us up to speed on, what this program really is and what are the goals for the program?
Yeah, happy to do that, Don. So the Healthy Housing, Healthy Community Partnership Project, so we call it H3C for short, supports the development of state housing finance agency partnerships with hospitals and healthcare systems and other health organizations to expand upstream investment in affordable housing. So what Kevin and Nora were talking about, what we're doing is leveraging the state HFA's role at the center of the affordable housing system to attract significant health institution involvement, and at the same time, importantly, elevating community level leadership to address the housing affordability crisis. So with the support of the Robert Wood Johnson Foundation, NCSHA awarded grants to 6 state housing finance agencies, Colorado, Illinois, Nebraska, Pennsylvania, Rhode Island, and Washington. And those grants are enabling those HFAs to sort of step back and plan and complete the due diligence and do the outreach necessary to secure the financial commitments from hospitals and health institutions and organizations. Important and essential element to these partnerships is the role that community-based organizations play to ensure that the programs that are being developed are responsive to local community priorities, right? So the participating HFAs, and frankly, there are other HFAs who are doing great work but weren't funded through this initiative. And Nora and Kevin can talk about some of those, but they're building real partnerships with hospitals and healthcare systems and engaging with community groups to develop sustainable programs that will ultimately result in the upstream investment in affordable housing. So that's H3C in short.
Thanks for that, Tracy. And so taking a step back for some perspective here, how does NCSHA's initiative fit into the innovative ways hospital systems are investing in affordable housing in the numerous places nationwide?
I mean, I'd say it's a great example of how institutions can strategically work to build mutually beneficial partnerships that aren't just sort of one-off, invest in one transaction and we'll see if we can do it again someday. It certainly requires a bit of a mind shift, I would say, around the table, that this is not a clear-cut cost savings play for the health sector. You can't tie an investment in a multifamily rental housing to cost savings 5 or 10 years down the line, even though common sense would tell you there will be some. It's not that direct, sort of accounting kind of cost savings. So I think that's a myth that has been out there a little bit on that, both in the health sector and on the houser side. And I think it's important to sort of burst that bubble. And similarly, I think that some health organizations have felt like they're being treated a little bit like ATMs, like, okay, here you are. We know you have money. We need it, And so again, the power of relationship building leads to sort of much more expansive thinking and possibilities. I would say, a couple things that we've seen is that, like, it's important that health institutions know, and housers as well, that, just grants aren't going to be enough to get it done, anything on the housing side. And so making sure that when folks are talking to health institutions, that, when we're talking about upstream community investment in social determinants of health, we're not talking about moving healthcare outside of the organization, like funding a mammogram van. We're not talking about providing transit passes to patients. I mean, these are all important things, or even paying for housing referrals. There is this obviously key connection between housing and health, but these are all things that can only be paid for by grants, and they don't change the availability of housing in a community, affordable housing. And so some innovative examples we've seen, I mean, Kevin will obviously can talk more specifically about what UPMC has done, but we've seen like Common Spirit actually has community investments, like a program where they've funded over $165 million of loans into affordable housing. United Health Group is buying low-income housing tax credits, so that's similar to the work that we're hoping that will happen with our H3C program. CareSource is a managed care and insurance plan where they actually have Federal Home Loan Bank membership and are leveraging that to support projects through sponsoring them through the AHP program. So that part was surprising to me. I didn't know that insurance companies would ever be part of a Federal Home Loan Bank, but I guess, there are reasons for them to do that. And it's just interesting to see the other ways, other than direct investment, that folks can get involved. And then the other thing, and this is also a great connection into what UPMC has done, a lot of hospitals may not have, especially post-COVID, or may not feel like they've got a lot of extra cash in their pockets, but they might have a parking lot that they don't need anymore, or other, underutilized campus space. And as we all know, land is a very valuable asset that can be deployed lots of ways, and an important investment tool as well.
Yeah, maybe Kevin, we'll turn it over to you, and right from your vantage point as a insurance and healthcare provider, why did your organization look at housing programs and investments?
Yeah, taking a little bit of pushback on what Nora just said, we do in some cases, so for us, this journey starts with meeting the needs of our members. And so since 2010, we've been working with a community partner, human services here in Allegheny County, to provide a permanent supportive housing model. And through that, it's really geared at serving just our health plan members. And over time, we are actually able to track and see the difference in those savings. It's not every member is going to see those kind of savings, but we do know that, when people have significant health, mental health, behavioral health concerns, that housing first really is the step to get them on the right trajectory. And so in those cases, we see a lot of success, and we've housed more than 150 of our members through that program since 2010. So it's a small number overall, but we're really proud of the success and the outcomes we see around that. The program ends up being about budget neutral, though, kind of to Nora's point, is, it's not generating a ton of money, but it's allowing us to move those dollars upstream. So that's really where our conversation starts, because it's like, well, why can't we house more members? And it's, well, there's a national affordable housing shortage. And so there just aren't enough doors for us to open and kind of help guide those folks through these innovative partnerships we have on the program side, which means now we need to look and think about those kind of community scale investments. So it's not just the programs that matter, but it's also just that total affordable housing supply that becomes part of the need. And so that's been our motivation, is how do we look at the balance sheet of UPMC and all of its various assets to think about how can we do at least small pieces to help enable more affordable housing to either be higher quality or happen quicker, right? So those are that's really the mission statement for us. So for us, it's kind of both of those pieces. And that's what leads us to the interest in this H3C program and partnering closely with PHFA as well, because it's also about, making sure that we have policies and programs that are addressing that need kind of globally. I mentioned at the top, just UPMC has this statewide presence, both in the form of operating 40 hospitals and one of the larger insurance companies in the state. So thinking about this at the statewide scale of the challenge is really one of the next things we're really interested in is, what does that mean to build a relationship with PHFA and other health partners to really kind of extend this work? And, there's a couple of examples we can point to of things we've already done that I think are interesting, but save that for a minute here.
Thanks, Kevin. Thanks for that strategic vision. I think, listening to that, I think it would give us us and our listeners sort of a clear roadmap of what you're thinking there. So how about we go into a couple of an example? So Nora and Kevin, can you give some examples of success stories, hospital systems, supportive housing, which we know may include things as direct financial investment as well as political support for housing programs?
Sure. Another hospital in the cohort that Kevin was in with UPMC was Nationwide Children's Hospital in Columbus, Ohio. And they actually, like UPMC, had already done a lot of great work in upstream investment in affordable housing. They had, and actually another innovative example, the South Side neighborhood that was right around their hospital campus, they supported affordable housing being built around there and realized that the challenge in getting a capital stack set up to have a fund that could really, make housing happen at the scale that was wanted and needed was providing some sort of credit enhancement and backstop to the loan fund. And so Nationwide in that case actually provided $1 million guarantee, unfunded guarantee from their balance sheet, which then unlocked 10 times the amount of resources from senior banks and other institutions that allowed that entire loan fund to work. And that guarantee, to date has never been called, as you can imagine, because actually affordable housing is a very not risky investment. But based on that, they then expanded into the neighborhood of Linden, which was also adjacent to, they had a lot of patients in that neighborhood and adjacent to where they were working. And while they were working with us in the cohort and COVID hit, set a goal of let's try to get 20 affordable rental single family homes built in the neighborhood of Linden, and using grants strategically for things that, really couldn't be funded otherwise. They started doing, laying the groundwork, doing the pre-development for those scattered site homes, which then allowed them to be, sort of ready. One of our sayings that we love is resources follow coherence. So because they had done the pre-development work, the sites were ready to go. City, at one point in 2021 said, oh, we actually have some money left over from another pot that needs to be deployed in 3 months. Can you use it? And they could, because they were ready. They then attracted funding from CareSource, another investor, from other local philanthropy, and Nationwide themselves made investments. They ended up with a over $4 million fund to build those homes. Built and based on that, have then now attracted resources and funding for another 30 homes that will happen over the next 2 or 3 years, including working with a local county land trust. So really being able to expand into different kinds of affordable housing, different funding sources that then, when I think what we've seen is when that authentic community priority is held up as the goal, that folks will line up and align behind it to make the funding happen. And I think the other thing we've seen with that is there's no example where a health system or a houser can go and do it on their own. It always requires a collaborative effort, and that it pays off dividends that you don't know, like when you start, how well things will happen.
Yeah, picking up on that, partnerships are key to this work. In everything we do, I can point to 3 examples here, and most of them is going to be from activities on the health plan, but it really starts with relationships across the board and also some of those capacity building elements. So one of the first things we did as we look to, kind of think broader than just our members and really think about community health and affordable housing in general was we use a program run at the state level. So it's the Department of Community and Economic Development in Pennsylvania runs what they call the Neighborhood Partnership Program. And so this is a tax credit program. So as I mentioned, UPMC Health Plan has a whole suite of projects from, employee supports to commercial insurance. And so some of those are for-profit entities, which allow us to be eligible for this program. And what we do is we make a charitable contribution, but then we're able to move our tax capacity to match that. So sometimes it's 2 or 4 times of a match, which goes directly to projects like single room occupancy housing in some cases with partners like a large nonprofit developers, but in others, it really becomes capacity building for community development organizations. And so that's one place I want to start. So one of our longtime partners is a Hazelwood Initiative, which is a mixed race, mixed income neighborhood that's about to see a 180-acre site commercial development kind of move forward in the next 10 years. So preservation of affordable housing in this neighborhood is key. And so that was some of the work that we were doing was, making sure that smaller community groups, especially in these key neighborhoods, have capacity. And so when we started on this journey and moving towards the investment side, the day that we hosted our, kickoff meeting with bankers and foundations and everybody under the sun we could get to come under one roof was actually the day they secured a purchase agreement with a neighborhood landlord who had 63 units. Didn't know how they were going to finance it. We didn't know what we were going to invest in. We get to where we are now, and 3 years later, we realized that we could make, matched mission-related investments to a community development finance institution locally, Bridgeway Capital, and they've, over the last 3 years, created about a $9 million capital pool. And there were 3 phases of that 63-unit preservation deal, and each one of those has a component that came out of that capital pool. And so that's been really exciting to see where, these early we're not quite sure how to get involved in this game, built the capacity to build the plan, to develop the pipeline before we even knew we were going to make these kind of investments. And so that's been really exciting to see when those kind of things line up. And again, we're, working, in step with nonprofit developers, CDFIs, and other experts to really guide the way that we approach this. And that's also that success and kind of what we've seen there has also really encouraged us to think more about some of these policy levers. So we've been involved with creating a preservation working group in Pittsburgh that's really thinking about how do we create additional capital to make sure that we're not losing units. So this is a huge concern generally. There's a lot of hot, small neighborhoods where rents are going up quickly, sales prices are going up quickly. So we know that having nonprofit or responsible preservation buyers positioned to make sure we're not losing naturally occurring affordable housing or those things that have subsidies attached to them is really important. So all of that kind of creates this linear arc. And then on the side, that's all the things we've done from the health plan perspective, because we know that 40% of the folks that live in Allegheny County carry a UPMC insurance card, so it really makes sense to move ahead with these things. But then additionally, it's where possible, we try to work with the health system. And Nora just pointed out land donation is a big asset that a lot of hospitals have, because while it looks like hospitals have all this money, it's already all budgeted, it's already all spent. So it's kind of deceiving. The margin's razor thin. But there are land assets and those kind of things. And so UPMC Presbyterian has donated, substantial partial that actually was the foundation for recent LIHTC awards. So it just awarded 2 weeks ago from PHFA with one of our long-term senior care partners, Presbyterian Senior Care, and that's going to be the site of a 51-unit LGBTQ-friendly senior community and right in the heart of our kind of Pittsburgh, Oakland campus. So all of those things are really exciting because we're seeing, kind of this natural progression towards preservation and towards more affordable housing investment. And then there's all these great highlights of being able to donate land. And there's other instances where we've done that as well. So, but that's kind of the one that where we have a project that's moving forward and we're really excited about it.
I'll jump in with one last example. I mean, obviously there are lots of ways that health systems are investing upstream, and Kevin gave great examples, and Nora could probably talk for hours giving all kinds of ways that we're seeing health systems and hospitals invest. The inspiration for the H3C program to have state housing finance agencies act as a community quarterback was really the New Jersey Housing and Mortgage Finance Agency's Hospital Partnership Subsidy Program. So New Jersey HMFA uses bond equity to match funds contributed from participating hospital partners. They have closed on 2 projects that are currently under construction. That's a combined $70 million investment in those projects, producing about 146 units of affordable and supportive housing in Paterson and Newark, New Jersey, and another 3 hospital partnership projects across the state, adding an additional 170 units, and another $70 million in total development costs are moving through the financing process. So I just wanted to shout out New Jersey HMFA sort of as the inspiration and the impetus behind the H3C program.
Great. No, thank you all 3 for those, and just that's a very inspirational, good case studies. I think that the rest of our listeners can see across the country. I'm just going to actually kind of wrap it up with one last question. I think all 3 of you can jump in on is, a lot of great things, why, and we talked about maybe it's cost neutral. And so what are like, I don't know, other challenges, or how do we get, more of this collaboration in healthcare and in hospital systems, thinking about, and each of you have maybe some different perspectives. So maybe Nora, maybe I can start with you. What are some challenges, or how do we, obviously these grants help with the NCSHA, but yeah, maybe some concluding thoughts.
Sure. I think what we've seen, and this is from the houser side, from funder side, and from health systems sometimes, is a hesitation to do anything until you've figured it all out. And I think what we would say is the best way to get started is to get started, and that this is, in real estate, it's hard to think about that as experimentation. And there's no one way to get started. We actually have a new toolkit that we wrote with NeighborWorks called Building a Health Partner Investment Strategy. But I think that provides, from the houser side, like a lot of good ideas about where, health institutions, like every institution, like there are a lot of things going on. And so there are a lot of different departments. You may be connected to the community benefits folks, but there's like all sorts of departments and people who can actually help make these things happen. And so, for the health organization side, similarly, whether it's finding external partners, finding internal allies, identifying opportunities, it's just start where you see a place to start. Think about it as a relationship building strategy, and, great things will come out of it.
Sure. How about Kevin?
Yeah. And I mean, from the health sector perspective, you might be surprised, that the institutions are already doing all this. So that's actually been one of the biggest things since we launched the UPMC Center for Social Impact. It was really an opportunity for us to, go across all the different departments and all across the programs and, kind of knock on doors and say, are you doing anything around housing? And we had, a surprising answer there. And so that's where, after we did that inventory was when we were really able to start putting together a strategy that took on things more comprehensively. And again, I think one of the things we've spoken the most about is some of the investment work we've done, but there's also a ton of different programs that are out there. So I think that would be my advice for community partners is programs are great as well. If you can, especially when it comes to the insurance side, where most of the money in healthcare actually kind of sits that's movable and investable, having programs that can take on and kind of address the needs of specific members. So we're doing a home repair pilot, a nursing home diversion program, a whole host of other programs that really meet those member needs. That's also a good way to build the relationship. But to the health system folks, that's not going to be enough. 1 out of 4 people that need a quality, affordable home can get one in the United States right now. So it's also about making those community investments with the guidance of the people in your local, in the service areas you're working with, to kind of bring that expertise and make good things happen. And it's kind of surprising how quickly some of these things can start to come together and layer.
I just add and point to, Nora mentioned the toolkit that CCI and NeighborWorks put out, and it's fantastic. CCI has also developed case studies and best practices and their framework. And I point to all of those as fantastic resources. The HFAs have found those very useful as they're sort of trying to hone in on how they're developing their programs, to look and see what other folks have done and the range of things that are being done around the country. And I just end with the thought that we, NCSHA, along with our partner CCI and with Kevin's great help, will continue to learn and to share what the HFAs are doing with their healthcare and community partners. Through the leadership of HFAs and the commitment and innovation of these partnerships, we are really excited to see what they're doing and to share what they're learning and what they accomplish as we go forward. And thank you, Don and Garrick, for having us on this podcast. I think it's a great service to the industry as we share this out.
Oh, great. And we want to thank you, Tracy, Nora, and Kevin, for what you're doing in the industry, what you're doing around health and housing. And thank you for your time today to join us in the Buzz House.
Thank you for listening to Buzz House. To receive a notification when new episodes are available, please subscribe to Buzz House, a Baker Tilly podcast, wherever you get your podcasts. For additional resources around multifamily housing, check out bakertilly.com. And if you have a suggested topic, please send them to build@bakertilly.com. That's BUILD @bakertilly.com.